Here are 7 signs that hypertension may be affecting your heart. Now, hypertension is a chronic disease and it means that your blood pressure is higher than normal. And when this happens for a while, it can affect major organs in the body. Top on the list is the brain, the heart, the kidneys. These are 3 common organs that hypertension affects. But in today's video, we'll be talking about the heart. Now, before I continue, I want you to understand that hypertension on its own do not have a symptom. Now, when you begin to see some symptoms, there is a possibility that this elevated blood pressure is beginning to affect some body organs. And in today's video, we'll be talking about the signs that you can see that can give you a pointer that this high blood pressure may be affecting your heart. I'll be using some medical words, but I promise to explain them, and trust me, you understand. In no order. The first sign I'll be talking about is what we call dyspnea. Dyspnea means difficulty in breathing, and in some people, it can occur when they are at rest. They are not really doing any hard work or engaging in an activity, but just at rest, they are feeling difficulty in breathing. For some others, it doesn't happen when they are at rest, but it happens when they are doing an activity like walking a distance or climbing a staircase, and just a short distance, they are already breathing fast, like panting. Just a short distance is a symptom that the heart may be affected. Number 2, easy fatigability. So here you just get tired easily for no just cause. You just notice that you're losing energy, you're getting tired easily. Maybe previously you work for about let's say using time 90 minutes, 2 hours, 3-4 hours without getting tired. Now you work even for an hour and it's like you've worked for a whole day. Easy fatigability, you get tired easily. This may be a pointer. The third sign is chest pain. You have a pain in your chest. It's always there, or it comes and goes. It's not something you previously had before, but you've just been noticing that there is a chest pain in any part of your chest. And chest pain is more common, and many people experience chest pain in form of, they will say they have heaviness in the chest, or the chest, there's a stabbing pain, or like there's something tearing in their chest. Different forms. Once you notice a chest pain, you need to see your doctor. Sometimes this chest pain can come with a feeling like like you're almost fainting, you're almost losing consciousness. Yes, some people may have such symptoms. It is a pointer to blood pressure affecting your heart. The fourth sign is what we call palpitation. Palpitation here is on a normal day, you're not supposed to, your heart is beating, pumping, doing its normal function, but you do not feel that beat. When you begin to feel that beat, we call it palpitation. Bim, 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 bim. When you begin to feel that heartbeat, we call it palpitation. And sometimes it comes and goes. Sometimes it can be there throughout the day. Sometimes it can come with activity. Another common symptom is fast breathing. Here the patient is breathing fast. Before, in fact, in some patients is even faster than what I'm doing here. Some patients will say their breathing is not coming down. Let me use the words of my patients. That is what we call fast breathing, and it could be another sign of a cardiac issue. The sixth sign is what we call orthopnea. I will explain. In these people, they realize that they can't sleep flat on the bed. Especially if they've always, maybe they could, whether or not there's a pillow, they can actually sleep. But when you realize that you can no longer sleep flat without a pillow and be comfortable, when you lie down flat, you feel like you're choking. You feel like your life is leaving you. You feel like something is compressing your chest when you're lying flat on the bed, and it makes you need to use pillow. Some people 1, 2, 3 pillows. Some people, in fact, they need to tilt their bed before they can feel comfortable. It shows that there's some congestion in the heart, and this may be as a result of hypertension. And the seventh what we call PND, paroxysmal nocturnal dyspnea. Now you're lying on bed at night sleeping, and then suddenly you wake up panting for air. It happens suddenly. When you begin to notice any of the 7 signs I have mentioned, it could be a possibility that hypertension you're having is beginning to affect your heart. Number 2, perhaps you are not even living with hypertension. You have never been diagnosed to be having hypertension. At that time, if you have noticed any of the symptoms, it's important that you go check your blood pressure now and type in the comment section, because I want to know what your blood pressure is. Another thing I need you to know is that all the 7 signs I have mentioned, they're actually symptoms, but I just use signs so that you can understand them easily. Some other disease condition can also present like that. For example, palpitation, where I talked about the heart, you noticing that your heart is beating bing bing bing. When some people are worried, anxious, or maybe preparing for an exam, or about to go for an exam or interview, their heart can start beating fast. But it doesn't mean that they have hypertension, or their hypertension is affecting their heart. So why I'm saying this is that when you have noticed any of the 7 symptoms I have talked about, you need to see your doctor. Your doctor will ask you some questions to know if actually this symptom you're having is actually from the heart, because like I said, other areas of the body can present with such symptoms. Your doctor may also require you to do some tests. Commonly, he might ask you to do ECG, electrocardiogram. Now, this test just shows how the heart is pumping, the electrical activity of the heart, and if there's any abnormality, most times it will pick it up. Hypertension is said to be a silent killer. Like I said before, it doesn't have symptoms on its own. When you begin to see symptoms, it means that it's beginning to affect some organs. Check your blood pressure now. If you're already hypertensive, please take your medications, take them correctly. Also check your blood sugar. Click this video to watch how high cholesterol affects your blood pressure. If you enjoyed this video, please hit the like button, share, and subscribe to my YouTube channel. Until I see you again, keep winning.